boys and girls. In the previous lesson, we were given an assignment to list 5 other careers you can engage in with the study of biology.
When it became apparent that schools were not going to reopen within a very short time, we thought that we should find a way of bringing education to the children.
In Sierra Leone, the government, with support from partners, launched an emergency radio education program.
Example, pediatrician, dentist, physiotherapist. You can also be a dietitian.
Every day when the teaching program started, they rush inside with happiness. You will see the joy. It'd be shouted, "Mommy, mommy, 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 where's my book? Where's my book? I want to listen to the radio program."
Although radio programming provided learning opportunities, it could not replace proper schooling. Once Ebola was under control, the next challenge began: getting nearly 5 million children back to school after nearly a year. The longer children were out of school, the more likely they would not return, and progress made to increase school attendance before the crisis could be lost.
Psychologically, it broke our educational system down. People were even afraid. If you hear that there were teachers, 2-3 teachers that died from a school, if you tell the parent to send their kids to that school, they don't want to do it.
Parents were hesitating. They said, since the Ebola has not done, finally, how are you going to take care of our children?
With the support of the World Bank Group, UN agencies, and other international partners, the governments of the affected countries devised a plan to mitigate the effects of the crisis on the education of millions of children and to gain the confidence of all parents and educators. First, schools had to be cleaned and provided with hygiene kits. Children and adults alike required daily temperature readings to check for fever, a key symptom of the disease. Educators and students were trained to ensure a safe learning environment.
And they were going out teaching teachers how to take care of themselves before coming to school and how they will put the subject matter into the curriculum.
Second, the countries had to ensure there were enough teachers in the classroom.
We lost some teachers in the system due to Ebola. So the whole process of identifying new teachers, training them, making them relevant for the classroom was also a big challenge.
By March 2015, schools began welcoming children back.
We went on radio stations, we went in the community from one end to another, encouraging our parents to take our children back to school. And in our schools, we have support of few organizations that are giving meals for our kids to attract them to school. But we have to do everything possible to get them to school.
In Sierra Leone, schools were closed for 8 months, resulting in a lost year of learning. But students like Augusta were anxious to be back learning.
When I grow up, I like to be an accountant because I like business study and mathematics. When they opened the school after Ebola, I was happy because so many months we were sitting at the home. When we come to school on that day, I was very happy. And when we come to school on that day, I was sad because our majority of our friends died during the Ebola season.
L'épidémie ici a un peu traumatisé les enfants. Pour rattraper le temps perdu, nous, les professeurs ici, on fait le boucher double. C'est-à-dire ici, on s'investit énormément ici en travail pour pouvoir ramener ici les enfants de l'Évan, c'est-à-dire en organisant des cours de rattrapage.
The education sector's short-term Ebola response plan proved effective. No new Ebola cases had been reported in any school. And in Sierra Leone, data from the 2015 school census shows at least 1.8 million students had enrolled, an increase over levels before the crisis.
In fact, because of the many interventions that we put in place. Bear in mind that government decided to pay school fees for all school-going children in this country, from class 1 to SS4. And that provided incentive for even those who had dropped out of school to come forward and enroll. So we are even now experiencing increase in enrollment.
However, progress was uneven. A closer look revealed the hardest hit districts had not yet fully recovered, and Ebola only added to the challenge of educating the youth of the region. Investing in skills, health, knowledge, and resilience of people or their human capital is fundamental to growth and shared prosperity. After more than a decade of war that ended in the early 2000s, the 3 fragile and conflict-affected countries are at the bottom of the Human Capital Index. Before the crisis, the countries had improved school attendance in an effort to increase the number of years of schooling that the average child attains by their 18th birthday, an indicator that alone can't explain the vastly different learning outcomes in different countries. Adding harmonized test scores helped reveal the longer-term challenge of low learning levels in the classroom. To more easily measure progress, the index introduced the learning-adjusted years of schooling, which combines quantity with quality of schooling. Now, the countries are striving to improve the quality of education through better leadership, curriculum, and teachers.
I think Ebola also was an eye-opener to other issues within the system. So we've been able now to carry out a national teacher vetting, and the focus of the education sector plan up to 2021 is quality improvement within schools, improving learning outcomes, and that triggers a lot of inputs. One is to strengthen teacher quality. So the national testing system was introduced, and teachers across the countries were tested, and based on that we can now design specific continuous professional development models to be able to enhance teachers' quality for the different levels of education that they are teaching at.
Teachers are the single most important driver of student success, but only with support from leadership and an effective curriculum.
Revising the curriculum to ensure that it is taken from a teacher-centered approach to a learner-centered approach with competencies for teachers and students. And then finally, the enhancement and strengthening of school quality assessment to improve the quality of teaching and learning within the school environment.
Launched in 2018 by the World Bank Group, the Human Capital Project is making a powerful case for investing in people. Investments that pay economic returns far into the future. Globally, an additional year of schooling yields a 9% increase in lifetime earnings. And the returns are even larger for girls, which often face additional challenges.
When I became pregnant, I was not able to go into school because I would become shame. I was not happy. I was in the sad mood.
The crisis also led to a spike in teenage pregnancies.
I want to go back to school because I want to be a nurse. And the reason being, those are medical people we have in our community, they can assist us. That's why I said if I finish my school, I want to be a nurse.
To educate pregnant and new mothers like Furia, the government of Sierra Leone began providing classes at community learning centers.
Without capacity, there is no development. We know the road is long and we are not even halfway yet, but with commitment, we can together achieve the results.
I totally believe that if you can put quality education into the heads of human beings and then take care of their health and make sure they are not hungry but have a balanced diet, that person is ready to face the world and achieve his or her potential.